Dr. Liu, I would like to talk to you about orthodontic work, straightening out the teeth. In fact, specifically, I would like to talk about Invisalign. It's kind of like a form of orthodontic which seems to be different and really became rather popular. But most of us don't quite know how it works and what the advantages are and what are the disadvantages are, if there are any. I'm sure there are. Please tell us about it. Shed some light on it.
Well, Invisalign, it's known as clear braces. Basically, these are liners made of a certain thermoplastic that move your teeth. Basically, one of the biggest advantage that patients love is it's a little more cosmetic. You don't see the metal braces in your teeth. You do wear it all day, 24/7, but the great thing about it is you can take it off when you eat, take it off when you clean your teeth, so it's a little more hygienic. Patients can clean their teeth at least. Yes, that's what they love.
So you don't have the spinach flag waving after dinner from the metal braces anymore.
No food will be stuck in the metal braces anymore.
Because there are no metal braces, and you take off that aligner. Now that aligner, is that kind of like to imagine it? Is that a little bit like a tray, like a mouth guard you kind of put on the teeth, and it is pre-measured 100% exactly in order to basically tweak the teeth?
Yes, that's right. We take impressions, we send it to Invisalign, they come back, these little liners almost looking like night guards or like a bleaching tray, and yeah, they use to move your teeth.
Okay, and they do you need to stop your phone?
Yeah, it's not mine. Sorry, I didn't know where his button is.
Okay, good.
Okay.
So you get those Invisalign aligners, and so number one, you did say that they really are invisible, or not really?
Well, I mean, from a distance, you can't really see anything. But if you get close up, you do see a little something. But it's much more aesthetic and cosmetic looking than the metal braces that are traditional.
How close you need to get? You need to get kissing distance to see it, or talking distance, kind of like 4 or 5 feet away. If I stand about 4 or 5 feet away from you, which is on an average a normal talking distance, would I see it?
You may see a little something there. It depending on how big the person smiles, you may notice something there. But if you don't look for it, then you may not notice anything.
That sounds pretty invisible to me.
Yeah.
And so being able to brush your teeth after dinner must be a big advantage, because I've heard that with regular braces, brushing the teeth is a very arduous thing. It's a very, you can easily get gum disease. So I've even heard like, okay, your teeth are now straightened, but now they're all falling out because you have gum disease. I mean, that's probably exaggerated, but if a person isn't very, very compliant with brushing teeth while having braces, gum disease will probably come in. Is that true?
That's definitely true. And with metal braces, you have to spend a little more time because food can get stuck in the brackets, in the back there, and it's very hard to floss because of the brackets and the wires. But with the Invisalign, it's great. You just take them out, you can floss normally, brush normally, and definitely your hygiene and any gum disease is reduced greatly.
So about back to this Invisalign thing. They're pretty invisible, but not. So let's assume a person is very conscious, and he has this all-important job interview, this all-important first date. What about if he during that time takes it out? Would that be a big disaster as long as he otherwise always keeps it in, or kind of like, well, all right?
Well, he can do that. We recommend the Invisalign be not out of your mouth for more than 2 to 4 hours a day. So if they have an important meeting, interview, or date, and it's within that time frame, then it's fine. As long as they immediately put it back in right after, then it shouldn't have changed any of their treatment.
Beautiful. Now, does the Invisalign require more time or less time, or pretty much the same than normal braces?
It depends on each case, but usually it takes a little more time, just because with the traditional metal braces, if the dentist decides they want to speed up the treatment, they can always tighten the wires or the brackets a little harder, a little longer. So yes, it may take a little more time, but you may feel a little less pain with that too.
Mm-hmm. Okay, all right. And more comfortable. What about the amount of time spending at the dentist going in and adjusting the wire versus those trays? Do you give him all those trays with him and he grabs one every week or whatever it is, and or does he have to come in and you kind of like monitor the whole situation?
Well, each case is different. If it's a little more complicated case, I generally like the patient to come in for the first 2 or 3 months every 2 weeks to change the liner so I can follow it. But if it's a more straightforward case and the patient looks like they're very compliant, then usually I give them for a month. So every month they would come in.
Okay. Well, wonderful. Okay, good. Anything else patients should know about Invisalign and the difference where Invisalign versus normal braces?
Well, Invisalign, what's great about them is that people have it's a great conversational topic. It's a great, it's something, and all the young kids love it. And it's something that is not frowned upon anymore. Maybe in the past, the traditional braces, oh no, I have braces, they don't smile. With Invisalign, you can smile as big as you want. People don't really notice. They just notice your beautiful smile.
Great. And would you say that, so those Invisaligns, I've heard that they were basically developed for adults in the first place due to the fact that adults have a harder time putting on braces and look basically ugly. And that the reason for young people it might have a problem is compliance. They take it out, they put it on the table, they talk, they walk away without it, forget it, even step on it, even lose it. Then you have to make new that aligner new, blah blah blah. So what did you find in your office in terms of are you doing it mainly on adults? Are you doing it also on young people? What's your take on it?
We do it mainly on adults, but we do some on teens. And you generally, for the first visit, if the teen is interested, we have to sit down with the parent and the teen, and we tell them, like you just said, if you want to do Invisalign, you would need to be very compliant. You would need to wear these. You would need to come see me every 2 weeks at least for the first months to follow it. And we give them a protocol to follow. And if they can follow this or agree to it, then most of the time it's a success, because we have to make sure beforehand that the patient understands what it takes to be successful with Invisalign.
Sure. And out of your experience, would you say that most teenagers who do take them actually are complying, or not so much?
We've had 100% compliant because they see the results and they see their teeth moving, and then they understand that this is something. There's a goal to get to, so they're very compliant actually.
Wonderful. Again, very informative. Thanks a lot, Dr. Lu.
Thank you so much.